My name is Kay Lucas. I have been a patient of Dr. Westover since the 1980s. I think he had just started working for Dr. Walker. And so I've been a patient of Dr. Westover's since the 80s. One day I asked him about dental implants, and he told me I was not a candidate, and which just kind of broke my heart, but that's the way it was, and I was handling it. So several years later, I asked Dr. Westover again, and he said, we might see what we can do about that. And started from there, and that was probably in April. I've had my implants for 5 years. That was probably in April, and I had my temporary implants by the end of June. I never gave up. I thought to myself, it's gonna happen. I don't know when, but it's gonna happen. And so the second time I asked him, he said, let's just see what we can do about that. So I did go to Denver for my surgery, and I went on a week that he was working there, and he was with me. And nothing could have been any better because I was totally relaxed.
Kay's been a patient of mine for 30 years. So we kind of went through some stages, and she doesn't mind me talking about it. She had, full denture, and then we had a lower partial dentures. Well, at some point, we went many years and we did well with that. But at some point we realized, under removable dentures, or partial denture or full denture, you continue to lose bone. We decided that it would be best to do what we call the all-on-4 technique. All-on-4 means and I've been, as a prosthodontist, I've been trained, it was 34 years ago, or really 36 years ago when I first started studying about these European systems, these implants. And I've seen it evolve, and I've seen how things change, and how expensive it was in the beginning to have a full mouth reconstruction on dental implants. Well, as the years have come now, we've perfected the technique. What used to take, say, 8 implants on the upper jaw to reconstruct or give someone fixed teeth, now we've gotten it down to 4. So the price has probably been almost halved for people. So therefore, a lot of people now are in the category of maybe be able to afford it, and we do the best we can to keep our costs down. But she's done really well at UK with this because she has fixed teeth. So we went from removable teeth to fixed teeth, which is pretty amazing that we can do that. And what's good about implants is the implants preserve bone, where removable, something that's artificially made that is sitting on the tissue of your gums, every year you lose bone. So the main thing about implant is it preserves the bone height so that we get what we call stability, we get foundational stability. And that's really important because, like I said, people need to chew every day for the rest of their life. So when you do the all-on-4 technique or any full mouth technique, you start off with a removable denture because that's like the blueprint to the final reconstruction. So what you do is we make you a denture, and we call it a temporary denture or provisional denture because we use that as a guide to where we're going to place the implants, how many implants we need, hopefully just 4 usually, or what is needed to support the position of those teeth. So we can even do that with digital help now. A lot of things are happening in the digital world that is just phenomenal. And we can make guides to actually place the implants from the CT scan Of course, we have a CT scanner. I was the first to have a CT scanner in the state of Mississippi, and I had to have it because of my cases are complicated. And we're on our second generation one now, and that shows everything, the exact amount of bone, where we need to put the implants, what kind of guide we need to place the implants. So, you know, everything is becoming much more precise. And basically we get her in, and we, once we're at the denture stage, then we use those dentures as guide with scanning and digital acquisition. We do that and we plan her case, and then we know exactly where to put the implant. So the first day she comes in, after you've had the denture, you're ready for what we call teeth in a day. What they mean by teeth in a day is that we can, when we do the implant surgery, you can have your teeth fixed to those implants, so you walk out with fixed teeth in one day. We took her before photos with everything she's been through, and we tried to put together a nice look that made her look like the teeth she had when she was young, you know, with a little wear to make it believable. But for the most part, you know, we try to get them back to where they were. I mean, her God-given teeth are the most beautiful teeth. And when you lose that, you just want to get that back.
For more information or to see if you're eligible for implants, give us a call